Hi, everyone. My name is Whitney Steinmetz. I'm a family nurse practitioner. I practice in Albuquerque, New Mexico with Presbyterian Medical Group. And today we're going to talk about some common questions I get from patients with MASH. So a really common question I get with patients in the clinic is, I don't drink alcohol, how could this happen to me? And I think it's a really good opportunity to talk to patients about the pathogenesis of MASH. A lot of patients' perception of liver disease is that it's an alcohol-related syndrome or it's coming from a virus. A lot of patients have that experience from either themselves or people in the family, or people in the community. So really important part to talk about kind of the pathogenesis. And also when they bring up alcohol, good opportunity to just talk about their alcohol use, their relationship with alcohol, see if there was any history of moderate to heavy alcohol use, but also important to separate the two syndromes. Another really common question I get from patients is, what stage am I in? What does this all mean? And to be honest, this is an important question we should be asking ourselves clinically. Do they have fibrosis? And if they do, what stage are they? It's a really important way to communicate with patients because they want to know what that is, what that means. We want to know what that is and what that means because it changes our treatment approach. Using non-invasive tools to do that is an excellent clinical question and tool. And also it helps us to see where there's reversibility, where's there opportunity for change, and what can we do to come up with a care plan with shared decision-making with our patients that helps them understand what's going on and how we do better. The last thing I get asked a lot is, I was told before I had fatty liver disease, is that the same thing? And a lot of patients have had prior imaging tests in the past. They were told they had fat on the liver. So it's important to keep in mind that patients can have fat on the liver or hepatic steatosis for other reasons. So if after they've had a basic serologic workup and on review of their history and risk factors, it appears like the steatosis is likely for MASH, then it's reasonable to assume that the previous conversation they had either with someone else or the previous imaging they had is likely for MASH. And you can bring those two things together, especially talking about progression and how can we make that better? And is there the opportunity for reversibility? Thank you so much. And if you have any other questions, please feel free to reach out.